How often are eye injections needed for macular degeneration? Have you ever wondered how often eye injections are needed for macular degeneration? This is a common question for those dealing with wet age-related macular degeneration, also known as wet AMD. The standard treatment for this condition involves intravitreal injections of anti-vascular endothelial growth factor drugs. These injections help control the growth of abnormal blood vessels and reduce fluid leakage in the macula, which is crucial for maintaining vision. At the beginning of treatment, patients typically receive injections once a month. This frequent schedule is designed to quickly reduce disease activity and swelling in the macula. After several monthly injections, if the macula stabilizes, the healthcare provider may gradually extend the interval between injections. This is done by about 2 weeks at a time to determine the longest effective interval for each individual patient, with a maximum interval of around 12 weeks. In practice, many patients start with injections every 4 weeks. As their condition stabilizes, the intervals may change to 6, 8, 10, or even 12 weeks, depending on how the disease is monitored through imaging tests. If any signs of active disease return, the injection schedule may be adjusted to shorten the intervals again. Some patients may find they need injections every 4 weeks for an extended period, while others can maintain their stability with injections every 8 to 12 weeks. Real-world data indicates that, on average, patients receive about 5 injections per year after the initial treatment phase. In the first year, intervals commonly range from 4 to 5 weeks, while in the second year, they may extend to 6, 7, or even 12 weeks or longer. It is also important to note that different anti-VEGF drugs can have varying durations of effect. For instance, aflibercept, marketed as Eylea, often allows 4 longer intervals between injections, typically around every 8 weeks. In contrast, ranibizumab, known as Lucentis, is usually administered every 4 weeks initially. The goal of this individualized injection schedule is to maintain vision and prevent further damage while also minimizing the treatment burden and associated risks. In summary, eye injections for wet macular degeneration usually start monthly, then gradually extend to intervals of 6 to 12 weeks based on disease activity. Ongoing monitoring is essential to adjust the frequency as needed, ensuring a balance between effectiveness and patient convenience. Always remember to consult with your healthcare provider for personalized advice regarding your treatment plan.